Dengue infections has nearly doubled in 2023, with over 123,000 cases, up by 86.3% from the previous year, amid a global surge in infections. On Neglected Tropical Diseases Day, Drugs for Neglected Disease Initiative DNDi Southeast Asia Director Jean-Michel Piedegnel shares the ongoing efforts into finding treatment for the disease.
Dengue is affecting a lot of what we can call lower income countries, right? And middle income countries. So the research on dengue remains fairly limited if you look at the number of people that are affected, the millions of people that are affected by this disease. So it has been on the list of neglected tropical diseases for a long time, and we still have today no treatment. We have some vaccines emerging, and we have some innovation in terms of prevention with the Wolbachia mosquito. Now, this is fairly recent, and this is still not enough to tackle the burden of dengue, especially in Asia, the global south. We have learned a lot in terms of dengue. We know how to treat patients, and there's less people that die from dengue. But the burden on the health system is tremendous, because we don't essentially have a treatment. So when we have a dengue patient, we put him in a hospital bed if we feel, he or she might get complication. And it's a lot of work to monitor that patient. So this is why, dengue remains a neglected tropical disease.
According to Jean-Michel, DNDi is forming a dengue alliance with dengue endemic countries, including Malaysia, to find a safe, affordable and effective treatment for dengue.
Today, dengue research is led by institutions in what we can refer to as the global north, very rich countries. To put an endemic country like Malaysia at the center of medical research means that we have the expertise of doctors and nurses that actually treat patients and have a really deep understanding of the disease rather than of the virus.
Jean-Michel also commended Malaysia's efforts in fighting dengue, but said more can be done by individuals starting at home.
Malaysia is doing quite well. I think the question is more, what can we do as individuals, in terms of prevention? I think all of us, and I can include myself in there, we are a bit lazy when it comes to preventing around our house or in our house, stagnant water. Stagnant water is where the Aedes mosquito breeds. So I think, what Malaysia could do is each of us individually should be really more responsible in making sure there is no stagnant water around houses, because, a lot of the dengue prevalent area are actually in urban area. It's where humans create the possibility for mosquitoes to breed.